Many patients, a lot of psychologists, trainees, internees, and freshers have asked me this question: Ma'am, how to differentiate between organic illnesses and functional disorders? So let's begin our today's session: how to differentiate between organic mental disorders and FNDs, that is functional mental disorder. So, organic mental disorders are a type of neurocognitive disorders which consists of, is that clear? Organic mental disorders are type of neurocognitive disorders which consist of observable and secondly measurable disease process. Example: inflammation, okay, or brain tissue damage, etc. Correct? Correct. Whereas functional mental disorder is also a type of neurocognitive disorder, but does not consist of any observable or measurable disease process. Is that clear? Second most important point in organic mental disorder: causes are known. Whereas in FND, causes are unknown. Is that clear? Causes are known in organic mental disorders. Causes are unknown in FND. We come on to the most important point, that is symptoms. Symptoms, okay? Here in organic mental disorder, symptoms can be explained. Explained by a known neurological disorder, right? And any medical abnormality. explained. Whereas here in functional mental disorders, symptoms cannot be explained by a neurological disorder. Okay, while we have come on to the symptoms and we know that symptoms can be explained. So what kind of exactly symptoms persist or exist? It can be decline in cognitive ability, okay, impaired brain function, decline in language ability, irritability, agitation, okay, etc. Agitation, etc. Such kind of symptoms that can be explained. Let's look at certain symptoms and examples here. Like here we can take examples like loss of touch, sensation, sometimes vision, hearing, okay, seizures, etc. So let's not ignore another important element while going through organic mental disorders is what can be the complications. What can be the complications? Here the patient can lose the ability, to function independently. Or may lose the ability to interact with others. Is that clear? May lose the ability to interact with others. We write with like this. All of you, all the medical students, I hope you know this is how we write with. Whereas in functional mental disorders, complications can be substantial disability. Right? Or we can explain it as poor quality of life. Due to consisting symptoms like anxiety, insomnia, panic disorders, right? Or pains, etc. So these can be the complications in organic mental disorders versus functional mental disorders. Have I made myself clear? Now let me brief you up with causes. How to differentiate organic mental disorders and functional mental disorders. Let us look at causes. Alright? Very important cause is there can be brain damage due to physical injury. Okay? Example, a blow on the head. Exposure to toxic or chemical substances or due to alcohol or substance abuse. As we all know, what do you mean by substance abuse is intake of drugs. So that can also be a cause. Whereas, very important, a psychosocial factor can also be responsible for organic mental disorders such as severe mental trauma, physical abuse, etc. Alright? So, these are the causes of mental organic disorders. Whereas in functional mental disorders, as we already know, causes are not known exactly. Not known exactly. Correct? And very significant points to remember here are: 1. There is no significant brain damage. No significant brain damage in FND. Secondly, any other disorder isn't responsible for FND. So, I have simplified how to differentiate organic mental disorders from functional mental disorders. So, I hope I have simplified this topic for one and all. Thank you so much and good night.